Assalamu alaikum. I'm Dr. Hosam Al-Qudah, Head of Urology Department at Faqih University Hospital. Today, we are doing this live broadcast about education about men's health. Issues that we'll be discussing will include prostate enlargement, erectile dysfunction, prostate cancer screening, and newer treatments for the prostate enlargement. I will start with a urological awareness survey that was done in Europe in 2018. They looked to see, are the people aware what do we do as urologists? And when they looked at this study, they found that, of course, with aging, men will know more about what we do as urologists. When they looked at the men around the age of 25 or under 25, less than 50% of them don't know even who's a urologist, while at the age of 55, 75% of men knew what do we do as a urologist. The prostate gland, which is an important part of awareness, only 1/4 of men knew where is the prostate gland located, and what's the function of the prostate. Just an update about the prostate. The prostate is a sexual organ present in the base of the bladder. It's important because it forms 1/3 of the seminal fluid that we ejaculate, and it's important also in the control of urine with the external sphincter that we have. When the prostate enlarges like this gland, it will start compressing. This is a huge prostate. It will start compressing on the urethra and causing us symptoms of prostate enlargement. When they ask the men about are they aware of symptoms that they mean that he may have cancer, only 1/4 of men answered confidently about symptoms of prostate cancer or testicular cancer. That's why we do these events. We would like to raise the awareness about the prostate. This is a brochure that presents on one of the websites in Arabic educating people about prostate cancer symptoms like frequent peeing, weaker pee, blood with the semen, pain in the pelvis. It's good because they raise the awareness about prostate health, prostate enlargement, and prostate cancer. When they asked about prostate, do women have prostates? And 54% of men did not know that ladies don't have cancer, and 37% of women thought that they have prostate. So it's really all about awareness. Having blood in the urine is one of the frequent things that we see in the clinic. Some men will present to us, also women, present to us with a urine test done outside showing some blood in the urine. It may be a significant thing. Unfortunately, 50% of people who were found to have blood in the urine will not come to a urologist. They will stay at home. They will think this is a normal thing to have trace of blood or some blood in the urine. It may be caused from a simple things like infection up to cancer cases of the bladder. So we would like any person who has blood in the urine discovered by urine test, he needs to see a urologist. Prostate cancer is the most important thing of part of our awareness. All these famous people, they had prostate cancer, so it may affect any person. Erectile dysfunction is the second part. It's present, it's prevalent. Around 50% of men will have weaker erections above the age of 50, and 2% of men will have no erections when they are above the age of 50. So it's really an important thing, and treatment may be easy. Incontinence is important. Obstructive and irritative urinary tract symptoms are important. Waking up at night to go to the toilet, all these are important symptoms that we need to raise awareness about and discuss. So what is prostate enlargement? It's simply, or BPH, it's simply obstruction of the urinary flow because of enlarged prostate gland. It's unpleasant urinary symptoms such as frequent urination, waking up at night, feeling an inability to empty the bladder completely. All these symptoms may be present. The prevalence increases with age. The higher age we have, the higher the percentage of prostate enlargement symptoms that we have. 40% at the age of 50 goes up to the percentage of 80% at the age of 80 years. The mechanism is simply because of growth of the prostate gland and result of dihydrotestosterone, which is a derivative of testosterone hormone. This may be causing abnormal growth of the prostate with aging. Symptoms, as we said, irritative symptoms like frequent pee, feeling of urgency. I have to go to the toilet quickly. I have to wake up at night to go to the toilet. I may leak some urine before reaching the toilet. These are the important symptoms. Obstructive symptoms. I may take some time to start. The urine is coming out weaker. It's interrupted. There's some dribbling at the end. I feel that I did not empty my bladder completely. These may affect our lifestyle, may affect the way we work the way we behave at work. We have to go frequently. We have to leave meetings to go to the toilet. So it is important to see a urologist if you have these symptoms. When I see the patient the first time, I just start with taking a history, focused physical exam. Sometimes we have to examine the prostate and do rectal examination. We have to ask him questions about the way he's peeing, how many times he wakes up at night. Some of the questionnaires that the patient may fill with us. We do a simple urine test because some of these symptoms are caused by infection of the urine, and we usually do this for men who are above the age of 45. Rectal exam is not a must in every patient, but it's needed in at least one time every 2 years just to evaluate the prostate feeling, which gives us an important feedback about the possibility of having prostate cancer. Prostate will grow with age, with time, as we said. Why are these symptoms caused? Because they compress in the urethra and it causes these symptoms of prostate enlargement. The progression of the disease was not treated. It take many years, but it will not happen in months. It will take years for the patient to go into acute urine retention where he cannot pee at all, or need a surgical intervention for the prostate because he's having stones or problems with bladder emptying. Sign and symptoms. Usually, these men, if they are not treated, as we said, they may go into urine retention, they may go to bladder infections, bladder stones. At the end, they may reach one stage where we rarely see these, but we still see it in some men where they get into kidney failure because of prostate enlargement. The simple tests that we do a simple urine test. We said we'll do the examination of the prostate, a blood test for the PSA. Uroflow is it's peeing in a toilet connected to a computer where the patient will just pee in that toilet and show us how is the flow of his urination. Doing an ultrasound, which is a clinic procedure done to evaluate the size of the prostate, if there is any hydronephrosis in the kidneys, the percentage of bladder emptying after urination, to see the residual urine of the prostate, the residual urine that stays in his bladder. The treatment options: first, watchful waiting, where we just observe the symptoms and we ask the patient to modify his lifestyle by reducing the fluid intake, especially at night. Avoid or moderation of caffeine and beer intake. Also bladder retraining, where he educates himself how to hold his urine and what training he needs to do. We need to review the medication that he's taking, because sometimes taking a diuretic at night may cause him to wake up several times. Also, we work on treatment or modification of medications. We work also on treatment of constipation because it may increase the symptoms of having prostate enlargement. Medical treatment and surgical intervention, there are the two main treatments. Now, the medical treatment, we have nutritional supplements that some men would prefer to start with, especially if they have very mild symptoms, including saw palmetto, pumpkin seeds, Pigeon africana. All these are herbs that known to relieve some of these symptoms. We have the alpha blockers, which several are available in the market, like doxazosin, terazosin, tamsulosin, and alfazosin. We have the 5-alpha reductase inhibitors, which works by hormonal changes in the prostate to decrease the size of the prostate. And we have two of these, finasteride and dutasteride, combination of the alpha blockers and 5-alpha reductase inhibitors. Sometimes also we combine with them medications called anticholinergic, which decrease the symptoms of frequency, irritative symptoms of urination. Also, we started using the PDE5 inhibitors like tadalafil 5 milligram, which is used to be used only for erectile dysfunction. Now it's used also for prostate enlargement. Minimally invasive treatments that are available. We would like to concentrate on these because they are much easier than the old treatment. Surgical therapies like open or robotic prostatectomies, using a laser or transurethral incision or resection of prostate and vaporization of the prostate. Teresium is the new treatment. It is water vapor therapy of the prostate. It's non-surgical. It's using the natural energy stored in water vapor or steam to remove the excess prostate tissue that is pressing on the urethra. It's typically performed. It can be performed in the clinic or as a day case in the operating room. It's each injection that we inject in the prostate from this water vapor takes around 9 seconds, and we evaluate the size of the prostate and see how many injections we need to in each prostate. Over the time, the body will naturally heal, responding by absorbing that vapor into the treating tissue. Shrinking of the prostate will happen, and the extra tissue that's removed from the middle part of the prostate will result in opening the urethra and reducing the BPH symptoms. Most of the patients will experience the improvement or relief of symptoms within 2 weeks, and the improvement may continue up to 3 months. This is the prostate, and this is how the resume is given. It's simply injecting the vapor into the prostate tissue. The prostate will be obstructed like this, and with time, it will open like this urethra. It's compared usually to medical management, and this is the prostate symptom score. And you can see that 9.9 points are improved with a combination of alpha blockers and 5-alpha reductase inhibitors, which are the medical treatments that we use for the prostate, while with the resume, more than 11.5 points improvement that is maintained up to 12 months after the procedure. It is important because the vapor, this resume treatment, it maintains the ejaculation of the patients, which is not present in the old treatment that were used before with the laser or the resection of the prostate. The Urolift, which is simply it's stapling the prostate, and it also this treatment when it's used, it may retain the ejaculation of the patient after the treatment. The vaporization, which either use electrical vaporization or laser vaporization of the prostate using green light vaporization. These are treatment to remove the tissue, and the classical resection, either bipolar or unipolar, where you resect part of the prostate tissue that's blocking the prostatic gland and blocking the bladder outlet. All these are available treatments. Nowadays, we educate the patients about the advantage and disadvantage of each treatment, and we titrate the treatment according to the patient. Patients with a huge prostate cannot go into the newer generation treatments, the Resume or the Urolift, while some of the huge prostates may have to go now for robotic or laparoscopic inoculation of the prostate, and sometimes we have to do open surgeries in rare cases. The other part of the talk is about erectile dysfunction, especially it's related to BPH, and we know that the older we age, also the older we get, we have high percentage of weak erections. As we said, above 50, around 50% of men will have some kind of erectile dysfunction, and the older we get, we have more symptoms. Now we start seeing men in their 20s, 30s, and 40s who have erectile dysfunction, different degrees of erectile dysfunction, and we have to discuss this. Risk factors, of course, as we said, increasing age, these are the proved risk factors for having both BPH and erectile dysfunction. Increasing age, weight gain, especially with abdominal obesity, and the higher intake of nicotine or the higher risk of smoking. Also, excessive alcohol intake. All these may affect both problems and cause both problems together. The effect of erectile dysfunction and the effect of age, the effect of prostate enlargement and the effect of age on sexual performance, and you can see that the prostate effect is higher than even aging. If I have enlarged prostate and if I have symptoms from prostate enlargement, I may get it may affect my sexual life and my also ejaculation problems that may be affected by prostate enlargement. So, what are the causes? What are the other problems of that men may have with sexual function? They may have the premature ejaculation, loss of libido, inability to get or maintain the sexual erection, also metabolic syndrome and affecting getting obese and testosterone deficiency. Causes, things that we can treat and we can avoid are stress. We can see lots of stress related things. That's why I put stress as the main three factors causing these problems with sexual life. Getting older, obesity, smoking, prostate enlargement, cardiac disease, testosterone deficiency, all these may affect us. That's why we should screen them. We should screen for them and we should educate people around them and about them, and we should treat these medical problems. Lifestyle change is the most important factor of the treatment because I may give you a pill and you may improve, but if you do not change your lifestyle, you will continue having the problem again and again. We should stop smoking, we should exercise, we should eat healthier, we should read from the right resources to be able to understand what's the problem and what we can do. And finally, please see your urologist who can give you the proper treatment. The last part of the talk, prostate cancer. And there's lots of controversy in the Western community about screening or not screening. And they're trying to save money by not doing screening, but we should screen because prostate cancer rates are high all through the world. They are having higher percentage of prostate cancer. It's increasing with time. The rates are less in Eastern Asia, but it's higher in the Western community. For us here in UAE, it's number one. It's number 4 cancer in the men, and we should get screened for. Overall, the world, it's the most common cancer, especially in the States. Second leading cause of cancer death in men. 9% of men above 50 will develop clinical prostate cancer, and 3% of will die from it. Diagnosed every 3 minutes, and a death every 14 minutes in US alone. Number 1 cause of men in their 30s, 40s, and 50s, and it's rising dramatically. Simply, we need to screen by doing, as we said, the PSA, by doing digital rectal examination, and by seeing our urologist for that. We should always remember that PSA is not going only in cancer, because we see lots of men in their 20s, 30s, they have higher PSA. It's caused by prostatitis. It may be caused by simply doing rectal examination, cystoscopy, physical activity, especially when it's like biking and things that may push on the perineum. They may cause increased PSA. That's why we should be aware of that, what type of activity the man has. And when we do the PSA, it should be done 48 hours after the last relation. We need to detect early prostate cancer, for the prostate cancer in an early stage, because it's a rising incidence and the mortality rates are higher if it is discovered late. We have aging population, men are growing in age, and the mean age is increasing with time. We do not understand the etiology 100%, the pathogenesis. That's why the preventive measures are not working like other cancers. That's why we need to improve the early detection. There is lots of controversies about treatments when it's metastatic prostate cancer. Only 20 to 30% of men, when they present, are present in localized cancer. That's why we need to detect it early, and we need to improve this rate. At least more than 50% should be discovered early by doing early screening. Risk factors for prostate cancer. Family history is the most important thing, especially family history of prostate cancer, also family history of breast cancer. Men who have African American origin, obesity, and high fat intake, all these may increase the risk of prostate cancer. The most effective way of detection is combined use of PSA and digital rectal examination. 10% of men with cancer have a PSA less than 4. That's why we do not depend on it 100%. doing PSA and digital examination will increase the detection rate of prostate cancer. At the end, I would like to thank you for attending this presentation, and we'll be more than happy to answer any of the questions that are put on LinkedIn or any of the social activities of Faqih University Hospital.